Hi, my name is Jalynn Johnson, and I'll be presenting on improving the birth outcomes among African American mothers to be. The purpose of this study is to analyze the causes of the higher mortality rate that's being found in African American mothers, as well as looking at the recommendations that have been made to alleviate some of these causes. So, within our demographic, it's found that 600 to 800 women die each year from pregnancy and childbirth within the United States. And this is actually attributed to all races. But it's found that African American mothers within the United States die at 3 to 4 times the rate of their white counterparts. And within Louisiana, it's 4.1 times more likely as their white counterparts that they're dying while they're pregnant or within 42 days after childbirth. Louisiana actually is leading in the United States for having the highest mortality rate right now, being 58.1 deaths per 100,000 births. So within the research, it was found that there were several risk factors being attributed to causing this higher mortality rate in African American mothers, which were environmental stressors, socioeconomic stressors, and an increased health risk. So, within these environmental stressors, it was found that they had a lower trust in the providers due to perceived racism. And so, if they felt like they were being discriminated against, they weren't going to trust the providers were giving them quality care, as well as if they did receive any racism, then their immune system actually was changing and causing a vaster amount of systemic inflammation. As far as these socioeconomic stressors, people within the Black community that are in a lower socioeconomic status do not have access to healthcare education. So this means they cannot learn about prenatal care, contraceptives, and as well as not having access to these healthcare facilities. So they're not able to access when they need to be able to get the care. Also, having an increased health risk. African American women were found not to truly believe in exercise. So, this is leading to obesity complications within pregnancy. They also were posing a higher risk of antenatal depression, which was leading to the pregnancy and birth complications early on. And they're also perceived to be more at risk for hypertensive disorders, thrombotic pulmonary embolisms, and cardiomyopathy. So, within this research, some of the things that were recommended were communication skills from the providers. Some women found that the providers were not being clear enough when they were trying to understand what was going on with them. And so that was something that was recommended, as well as implicit bias training for these providers. It should not only start while these providers are in school, but also every year while they are actually seeing their clients and their patients. Providers should also assess for the mother's activity level early on in a pregnancy to understand that she's getting the needed exercise, also giving her recommendations for nutrition to keep her healthy. Also, there should be an improving public education about common pregnancy complications. So it's typically seen that African American mothers suffer from hypertension and the pulmonary embolisms. So the public should know about this, and the women should be given, tips so that they know the signs to look for if they start to experience any of this. Also, creating accessible and affordable health care. These women cannot get the care that they need if they can afford it or if they can't even access it. There should also be an increased screening for mental health disorders early on in pregnancy. The depression was found to really create a lot of pregnancy complications within these women. So, being able to receive those screenings early on can let the doctors know what type of stressors they are or they may be experiencing so that this can be alleviated. So, these are some of the recommendations for this topic. These were some of the references. So within this topic, there is a high rate of maternal mortality in this African American mother. So hopefully within these recommendations, this can alleviate some of it, and especially in Louisiana. Thank you.